It is 12 o'clock Eastern, and I do want to get started because we have a jam-packed hour, and we are so happy to be able to bring this information to you. My name is Melissa Sheldrick. I'm the Patient and Family Advisor at ISMP Canada, and one of the team leads that helps to bring you this network and this webinar. And we're so pleased that you are here to join us today. And so before we get underway, we want to just let you know that ISMP Canada has a number of e-learning modules and in-person workshops or live virtual workshops that you can look at and register for, including incident analysis for long-term care. And you can go to ismpcanada.ca/education. And if you are a member of the network, you can claim a 10% discount. So we encourage you to have a look. And one of the great things about being a part of this network is that we often look to folks to be more engaged with us at ISMP Canada, and wondered if you would like to use your voice to help advance medication safety. We are always looking for healthcare providers and consumers, members of the public, to be reviewers for our ISMP Canada safety bulletins or our consumer newsletters. And so if you have a specific specialty, for example, oncology or neurology or something like that, or if you are a person with lived experience in a particular medication space, we would love to hear from you if you would like to help us review these publications. It's not too onerous. It usually is a couple times a year, maybe 3 times a year. But if you are interested, please let us know at medsafety@ismpcanada.ca, and we will definitely reach out to you. And as always, we would like to take a moment to acknowledge the land on which we are working. This land acknowledgement is based on the office of ISMP Canada, which is in Toronto at Yonge and Sheppard. And we acknowledge we are hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and the Inuit peoples. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls to action. You are also welcome to include your land acknowledgement in the chat and let us know where it is that you are calling in from. If you haven't had a chance to do so, please introduce yourself in the chat. We love to see where everybody is from across the country. So today our webinar is titled 5 Essential Components to Advance Medication Safety in Your Organization. And this is leveraging the success in Ontario long-term care homes that we've had as an organization that we're so excited to tell you about. This is our timeline for today, so we'll have a brief introduction. We are so honored to have Shirley Drever come and speak to us today about her work from ISMP Canada to her role at Sienna Homes. And then we are going to go into our breakout rooms and have a further discussion about whatever component you registered for. You will automatically be taken to the breakout room, and then we'll come back together and hopefully have some time to share a little bit of learning. Before we do that, we always start our webinars with these 3 poll questions. So we want to learn more from you. So Suma, if you would please launch the poll, and if you could answer these 3 questions. What is your primary role in healthcare? Have you or someone you know experienced an issue with the safety of medications? And is this your first Canadian Medication Safety Network webinar? So you'll see that pop up on your screen. Okay, and people are already filling it in, which is great. Thank you so much. Let me see, we have pharmacy team members, nurses, quality improvement and patient safety folks. Look at that, 7 people have responded, 8 people have responded, but the vast majority is that someone in your circle has experienced an issue with the safety of medications. And that's why we're here. That's why we come together and we do what we can to advance safety across the country and in all different settings. And lots of new people here at our webinars. So we are so happy to welcome you and thank you to those of you who are coming back. That speaks to the quality of the webinars that we hold and the information that people are taking away. So we're truly grateful for you to come back. So just take another couple of seconds and then we'll end the poll. Okay, thanks, Suma. Um, Coincidentally or not, this Friday is the National Long-Term Care Day, and thank you to the Canadian Association for Long-Term Care for supporting this day. And we will be contributing to some social media messaging on Friday as well. And we're really grateful to be able to recognize the staff and the leaders and everybody involved in long-term care, the residents and the families who make their voices heard and who are all part of this very important community that exists for many people as they move into their latter stages in life. And so with that, I'm going to turn it over to Carolyn.
Thank you, Melissa. My name is Carolyn Hoffman. I'm a registered nurse and CEO of ISMP Canada, and so happy to be here. I'm also the executive sponsor for the Strengthening Medication Safety and Long-Term Care Initiative. And so, first of all, let's start with an acknowledgement. A big thank you to the Ministry of Long-Term Care in Ontario. They have worked and funded us for the past 5 years, and we've recently just received a new 3-year agreement to continue this amazing work into the future. We want to point out specifically that the work we do with homes and support homes to do includes addressing Justice Galiza's specific recommendations with respect to detecting potential medication incidents that would otherwise go unnoticed. Justice Galiza's inquiry report, now over 6-7 years old, but so relevant and so important, and encourage you to take a look at that report. And you will see that the components of the Strengthening Medication Safety in Long-Term Care initiative address those medication safety recommendations in the report. On the next slide, a very brief overview to introduce those in the Medication Safety Network across Canada that may not know about the initiative, and to highlight a bit of what's going on. To the right, you see a visual of the 5 fundamental essential components of the initiative. They're designed to be the foundation for understanding medication safety in long-term care, and we believe across the healthcare sector, understanding it well, prioritizing areas for improvement, and successfully attaining those improvements. For over the last 5 years, we've been open to working with homes on a volunteer basis, and homes have responded. Over 550 homes in Ontario have completed the ISMP Canada Medication Safety Self-Assessment for long-term care annually over the last 3 years. Looking at how they're doing, and that fits so beautifully under measuring and evaluating, that component down to the left. Where are we in medication safety? We have to know. The self-assessment gives homes the ability to have that baseline and see how you progress over time. We also have developed indicators to help with measurement and other targeted tools and resources. Over 100 homes in Ontario have received one-to-one QI coaching to support their prioritized areas for improvement. And that falls under that yellow area, quality improvement. Quality improvement, we know, is a science. We need the experts to help us have the science. And it's also an art. So combining the two is very important and essential. Otherwise, we're not going to implement strong actions and they're not going to be sustained. Over 500 long-term care staff, physicians, residents, and others have attended the Incident Analysis for Long-Term Care live interactive virtual workshop that we offer free through the funding to those homes in Ontario. Anyone outside of Ontario, you're happy to join. We can help you. There'll be information on how to contact us all the way through today. That falls under beautifully the blue area there, incident analysis. When a bad thing happens, and we know that it does happen in healthcare, all across healthcare, we need to be meaningfully able to understand what happened, which is not always easy, but that's got to be the first step. Why it happened, contributing factors in the system, going beyond individual actions to what was going on in the system, and what meaningfully strong actions can be taken, measured, evaluated for improvement and sustainability. I will highlight the two other areas, tools and support. We have a wide number of free draft model policies, free resources on our website, targeted resources across a number of areas. And I'll give a brief nod to two specific areas. One is resident and family engagement, the orange area there. At the heart of everything we do, we need to have their voice in what we do to meaningfully improve medication safety. Melissa and others have partnered to develop resources that have now been translated into many different languages to help support insight and awareness. And if you want more information about that, we're happy to help you connect. And one final area, which is going to be a big area going forward, is the appropriate use of antipsychotics in long-term care. Shirley and other staff, in addition to staff with ISMP Canada, partnered with other experts to complete an AUA handbook. Fresh off the production line, as we say, it's only a few months old. And later in June, here's an early heads up, we're launching an AUA cohort to support homes in Ontario that want to work on that to further improve. So with that, I hope I've piqued your interest in an innovative initiative that has many different supports. But having supports, what good is it if you don't have amazing leaders out there that will pick them up, that will take time, give that extra support that's needed to bring it into an organization, methodically develop and implement what happens in the organization. So what better than to have an expert? And today we have Shirley Drever. I first met Shirley almost 5 years ago when we hired her to work at ISMP Canada to help us develop the initiative that you're going to hear about today. And a few years ago, she transitioned, and I'll leave it to her to talk about her medication safety lead role for Sienna if she wants to add anything. She transitioned to take those great tools and her passion into Sienna Living, an organization not only in Ontario, but with organizations across Canada as well. So a big role, Shirley, and you're doing amazing. And so a big thank you from ISMP Canada for taking the time to talk today. Over to you, Shirley.
Thank you so much, Carolyn. I really, really appreciate your endorsement, and I can't tell you how much I did learn in my years at ISMP Canada, and I do miss the team for sure. So I did transition a couple of years ago to the position of clinical medication safety pharmacist for Sienna Senior Living, and we have homes in Ontario and as well as Saskatchewan, Alberta, and BC, retirement and long-term care homes. So wide variety of homes over all different shapes and sizes and different challenges across the whole sector. So, it's hard to believe that much time has gone by and 2 years have already elapsed since leaving ISMP Canada. So I'm going to ask you, Melissa, to go to the next slide, please. So when I was with ISMP Canada, I was the project manager for the Strengthening Medication Safety and Long-Term Care Initiative. And, it was a really tremendous opportunity to have the ability to use your knowledge and your understanding of medication safety to be able to actually apply it in real life. Because Carolyn and I were having a little conversation before we started today. And, it's one great thing to develop resources, but it's even better when you can see them working in real life. So I've been able to use a lot of the things that I learned at ISMP Canada to apply in the long-term care sector in Ontario, especially. So, we started this journey back in 2023, and this is a really busy slide, but I will I will take you through it in a stepwise sort of fashion. So, back in 2023, we started looking at the different ISMP resources that we could use on a day-to-day basis in Sienna Senior Living homes to start to improve our medication management processes. So, there were a lot of things that we could use, lots of resources to start with. And I was very familiar with them. I was very fortunate to have that familiarity with them. So it was easy for me to pull them into active sort of duty from the ISMP Canada website. So with any sort of quality improvement initiative that you're looking at, you always want to start with the data. Okay, you have to have data to support what your decision making is going to be. So we were able to take the medication incidents that were reported by Sienna Senior Living for a whole year from 2022 to 2023 and look at them collectively, do an analysis from that data to determine not only whether we had to do anything as far as driving incident reporting, but also what sort of opportunities were available to us to be able to improve our medication management processes overall. So one of the big learnings from ISMP Canada was that the best place to start is the culture in your homes. So when we were looking at this this incident data, we were looking at the quantity of reporting as well as the quality of reporting. So from a quantity perspective, when we were being compared to other peers, other long-term care providers, we were on the lower end of reporting. And we get statistics from our pharmacy provider that tells us on a per thousand bed sort of um, rate how many errors we're actually reporting versus the other peers. So we were, like I said, on the lower end of that reporting. So we knew we had to do something to drive that reporting, to improve the number of reports that were happening. We did feel that we had underreporting in some homes for sure. So we did a lot of work on developing that just culture. And, it's easy to throw around a term like just culture, but when we're talking about improving the culture, you have to start from the ground up. And what we did was we did a lot of education on what it means to have a just culture, that in our approach to incidents, we would be looking at the system that people were working in versus a blame and shame sort of focus. So we did a lot of education. We did a lot of promoting just culture. We made it, we embedded it into the way that we approached every incident, from the most minor to the most severe. We used the same approach and took the blame and shame out of the equation. So that brought us over to Q4 2023. At this point in time, we looked at the information that we were able to gather from the incidents that we had in our past, in our history, and decided on two main initiatives that we wanted to improve based on the trends that were isolated in that analysis of incidents. So the first one was that we had a significant amount of errors related to distractions and interruptions of nursing staff when they were administering medications. The second was that we identified that there were a lot of more serious incidents related to hypoglycemia, and that there was some knowledge gaps for the nurses, but it just needed a renewal. It just hadn't caught up with the most recent information that was out there about diabetes management and management of hypoglycemia specifically. So we endeavored to look at ways that we could improve those particular two types of initiatives, and we're able to have some pretty great success. So over the course of 2024, we actually increased our reporting of incidents by 20% from baseline. So huge number increase, And we felt that that was attributable to the new approach on just culture and system focus that we were using within the homes, and we're spreading across the organization. Secondly, as far as diabetes management was concerned, we placed a focus on the management of hypoglycemia. That was one of the trends that we saw was really not being handled, 100% of the time the way that we'd like to see it. So we developed 3 modules to help the nurses to understand more about hypoglycemia and managing hypoglycemia. And we were able to really increase their abilities to have confidence with approaching hypoglycemic events. It's scary when somebody has a severe unresponsive hypoglycemic event, and we wanted to give them the confidence to be able to approach it and to be able to manage it effectively. There were a lot of things that were being done that, maybe we thought were good, but could be improved a little bit better. So we did over 2024 significantly see hypoglycemic management improve, and following the recommendations from Diabetes Canada. In 2025, sorry, I'm going to go back a little bit here. You can see the yellow sort of line across the center of the slide. In 2023, in May of 2023, legislation changed to allow PSWs to give certain medications in long-term care in Ontario. And Sienna Senior Living developed a program to be able to allow, under certain conditions, PSWs to give medication. So we started rolling this out as early as Q3 of 2023, and we're still rolling it out now. We have 28 homes that currently have PSWs giving medications in long-term care in Ontario and in BC. And those homes have noticed a significant decrease in medication administration incidents because PSWs giving meds do not get interrupted nearly as many times as a nurse does. And we built into the program checks and balances that were going to enable PSW med admin without interruptions. So we put different parameters in place to make sure that happened. And we, after 1.5 years of PSW med admin, we have had significant decreases in med administration incidents. The PSWs are making less med errors than the nurses, but the nurses are taking care of much more complicated medication regimens. So if we bring it forward now to today, we're continuing to roll out PSW med administration with the objective of getting to all the homes in long-term care Ontario, Sienna homes in long-term care Ontario to be rolled out. And we'll continue to do that until everybody has PSWs giving meds in the homes. Aside from that, we are working very diligently on the antipsychotic deprescribing initiatives, as well as deprescribing to reduce falls. So that's kind of where we're at today. So if you can go to the next one, Melissa, that was my big slide that entails everything. So we'll go to the next. I did want to highlight that we do use a lot of ISMP Canada resources in our work with medication management and medication safety in our homes. So a couple of the things that kind of stood out for me that were big, impactful things were that just culture. And in the incident analysis for long-term care workshop, we have a video. ISMP Canada has a video that talks about just culture, and it's done by NHS. And you can look for it. I'm sure somebody from ISMP can give the link online, but it was really good at helping to kind of set the stage, looking at system-based errors versus blame and shame sort of mentality. It really did help us to drive that just culture within all of our homes, that this is the standard. This is the way we do things around here. So it did improve that psychological safety within the reporting of incidents in the home. The second thing that I can't say enough about is the incident analysis for long-term care workshop in general. We had at least one leader from every one of our homes attend this workshop. We currently had 108 leaders from Sienna who have studied and applied this methodology in incident analysis in our homes. And I wanted to point out here that the methodology that is taught in this great workshop is applicable to other types of incidents, not just medication-related incidents. So we did actually use this methodology for lifts and transfers. We had several incidents involving lifts and transfers a few years ago, and we used this methodology to help us to determine what the root causes were and how we could address them. And we continue to use this methodology to this day, and becomes again, part of the way we do things around here. So we use this methodology to different degrees depending on the situation every day. So we can go to the next one. So just talking a little bit about that data collection that I referred to, again, it was from 2022 to 2023. We identified those system gaps and, back to the just culture versus blaming individuals. We look for those trends. The two things we identified were the management of low glucose levels and nursing distractions. And then one of the things that was a bit of an aha moment when I was working at ISMP Canada is that when you're trying to find a solution to a contributing factor that you've identified, we are all troubleshooters. We're all people that want to fix things in long-term care as well as across healthcare. And we often jump to a solution and we don't do a full sort of analysis or a deeper dive into whether we're actually addressing the problem or not. So using the 5 whys, if you're not familiar with 5 whys, basically you identify your contributing factor and then you say, why did that happen? And why did that happen? And why did that happen? Until you get to something that you know can be actioned and can be measured for impact. Because if you're not measuring for the impact of your change, you don't really know whether you had the expected thing happen or the expected change impact happen. So it's really important to do that deeper dive, to ask the 5 whys and get to the bottom of the issue. And the last thing I just didn't want to forget is resident quality of life. We put this central to everything that we do at Sienna. It's our motto is to cultivate happiness in everyday life. And so we want to be sure that any changes that we're making are going to be a positive experience for our residents. So you can go to the next one, Melissa. This is one of the tools from ISMP that I actually feel is one of the tools that was the most impactful for me. It's called the hierarchy of effectiveness. This basically highlights that you need to have both person-based and system-based interventions in order to be successful when you're trying to address a problem. We find that person-based interventions are not usually as effective as things that are more higher leverage, like a forcing function or an automation or something that's technological. But what we need to do is we need to have a combination of different interventions. So, for example, when we were looking at the hypoglycemia issue, we did a whole bunch of education that was related to, helping our nurses, our frontline staff, be able to address situations where hypoglycemia occurred. So filling those knowledge gaps to start with. But at the end of the day, one of the most effective things we did was we introduced continuous glucose monitoring for our insulin-dependent residents with diabetes. And so by intervening with that sort of continuous glucose monitoring, that technology, we were able to better identify when hypoglycemia was occurring and reduce hypoglycemia by 50% in the pilot study that we did over 3 months. So you need education, you need rules and policies, but that are not the only thing. You need to have higher leverage interventions in order to get sustainability with whatever you're doing in quality improvement. Next one. So we've already talked about this. We did the enhanced management for quality of life. We presented this at the LTCA conference, and those were the things we did, was the interventions. The PSW medication administration, what we were trying to do with this is reduce the burden on nurses to administer all the medications. And I did allude to the fact that right now we have about 40% of the homes that are live, that 40% of the residents in the homes that are live are given their meds by PSWs. So that has really taken some of the time for med administration from the nurses. We've actually seen a significant change. They have more time to do other things like the assessments that are required to be done by nurses, direct resident care, care plans. And so that has been a significant change that's happened because we were trying to reduce the number of errors caused by distractions. So right now, we're in a really good steady state, and we'll continue to roll out PSW administration further to other homes. So we know the next one. So this is just a summary of some of the results that I've talked about so far. So we had a 16% reduction in med incidents over the past year. So that's pretty significant for a large organization such as Sienna. We are much better at managing severe unresponsive hypoglycemia and following those Diabetes Canada guidelines consistently. We had a 13% reduction in harm incidents over 2 years. So we use the category E and F incidents to designate what we call harm incidents. And so we did have a significant decrease in those most severe as well. We use the ISMP incident analysis methodology all across our organization now. We have 300 PSWs administering medications in 28 communities, and we've had a reduction in nursing time for med admin by up to 30% at the same time reducing med administration errors. So these have all been very positive things that are happening, but the work is never really done. So we continue to look for opportunities where we can intervene on the different medication management processes and continue to use all the wonderful resources that are working very well for us that were provided through ISMP Canada. So thank you very much.
Well, thank you, Shirley. That is incredible work that is happening at Sienna, and it really is amazing to see how these resources that have been, building over these years and that we've been, refining with the help of our homes are really being put into practice and are making some true measurable differences. So thank you for bringing that to us. Okay, we are going to move into our breakout rooms. You chose your topic when you registered, so thank you for doing that ahead of time. And once we come back from our breakout rooms, we are going to ask the facilitators to put one gem into the chat. And we're going to stay in our breakout rooms till about 12:55 Eastern. So with that, Suma, if you could please send us to our breakout rooms, and we will see you in about 20 minutes or so.
Functions.
Okay. Okay, so while everybody is coming back into the room, as per usual, the time just goes by so fast. So facilitators, would you please do me the favor and all of us the honor to share just one learning from your breakout room today, so that people can have a look at it before they go today. You will all receive a copy of the report that gets put together, so this information will be captured for you and sent to you. And while our facilitators are doing that, we're going to launch this last poll. So Suma, if you could go ahead and launch that now, please. What would you like to learn and share about at a future meeting? These webinars are driven by your interests, your concerns, your identification of issues and risks and opportunities that occur across this country. So we have identified 5, and we'd love for you to choose your top 3, right? Advocacy 101. What does that look like, and how do you do it? We hear a lot about shortages. Multiple medications and polypharmacy is a hot topic. Safe label and package design, sometimes there are concerns with that. And then sharing and learning from reported incidents. So please choose your top 3. And that will help us to plan our next webinar, which will hopefully be in the fall, late fall or early winter. We're not sure just yet, but you'll get notified as a network member. You will receive an invitation into your inbox. So thank you. I see that poll is going very, very well. So do continue to add to the poll. I am going to just put this slide up. If you could please complete this survey. Let me just get that into the chat box for you. You can either scan the QR code or you could put it, you can click the link in the chat box, and that's so helpful for us to know more about what worked well for you in this webinar. What are your ideas to make it better? We operate in a continuous quality improvement cycle as well, and want to know how we can continue to make this a valuable time for your valuable time. We have a LinkedIn group. So if you are on LinkedIn, come join us at the Canadian Medication Safety Network, and you can engage with colleagues within the group. And then that last QR code will take you to our website where you can hear recordings from our past webinars. There are reports there about our past webinars and the learnings that have happened. And we would invite you to have a look at those as well. And again, the engagement opportunity, if you would like to be part of reviewing our safety bulletins or consumer newsletters, please reach out at medsafety@ismpcanada.ca. And with that, I just want to wrap this up by saying thank you so much to Suma, our tech host, our facilitators, and our note takers, to all of you for sharing your incredibly valuable time. We know how busy your days are, and for you to come and spend an hour with us, we are very grateful. And so with that, I will sign off, and hopefully we will see you all in the fall at our next webinar, and sooner on our LinkedIn page. So thank you, and have a really terrific day and rest of your week.